Hello, America. I'm Robert Reese, and welcome back to CEO Show. We're here today with Jeffrey Flaks. How are you, Jeff?
I'm great. Thank you, Robert.
And a pleasure to have you on again. Jeff is the president and CEO of Hartford HealthCare, and this is a $7 billion organization, about 45,000 employees. They do 27,000 people they will care for every single day. And you are really changing everything in terms of access. Talk about what your model is.
Yeah, well, I feel so strongly, Robert, that there's a tremendous need, there's a mandate and such an opportunity to improve access to healthcare across America, and certainly here in Connecticut. So we're working hard to ensure that no person is left behind, no community is left behind. We're trying to create healthcare on demand. Robert, think about every other part of everyone's lives, right? They get their transportation on demand. They get their groceries on demand. They get their entertainment on demand. People expect to have their goods and services delivered on demand with price transparency at a point in time when they want to receive it. We have to do better in healthcare, and we have to dramatically improve access, and we have to improve coordination and navigation and remove that fragmentation from healthcare. So we've been on a mission to get better every day at this, and to dramatically improve access. And there's such opportunities today through innovation to do it differently and better.
Now, you're, of course, a leader on a national stage. What advice do you have to other CEOs in healthcare on what they could do to increase access?
Yeah, first, I think it begins with we can't protect the status quo. We have to change it, right? I mean, the things that have created the historical backlogs that we all work through, they have to be disrupted. So we've got to figure out new and different ways to do things. And Robert, my point of view, there's never been a better time in healthcare than now and in this moment. And in many ways, people point out the very legitimate and real headwinds that we're up against, the issues nationally around Medicaid and
Yeah,
Medicare.
wait. I can't see this being the best time in healthcare. You got to walk me through that.
All right, look, there are legitimate headwinds, right? Medicaid, clearly, some of the federal guidelines, some of the issues that we're having to work through around access and payer relations, very real issues. That being said, there's never been a time and there's never been a moment where you can get better faster than we can now in healthcare. And I'll just give you, Robert, some examples. We're partnering today with companies like a Bridge, which are completely revolutionizing the patient experience when patients are in the office today. The providers now are providing direct care to the patient and not to the keyboard because of the artificial intelligence that a Bridge enables to automate that visit. We're seeing things in like ADOC today that are being used to improve the quality and the efficiency and the effectiveness of imaging and the speed in which we can do imaging and reporting out of imaging results. And most importantly, Robert, we launched something here called HHC 24/7, where we're now providing 24 hours a day, 7 days a week, primary care and immediate care to any patient, to any person, any consumer who can download on their app, from the Apple App Store or wherever they get their apps downloaded, HHC 24/7, and it's a very smooth, efficient process, AI enabled, and they can make an appointment for 2 o'clock in the morning at home or 2 p.m. or they want to do it in a conference room at their work, or they can enter the queue and be seen in 7 minutes or whatever that moment in time is. And that's how we're changing access. We're using different types of technologies, different capabilities to solve, these really historically very difficult problems. And we're seeing several hundred people a day through HHC 24/7. And we're seeing more every week than we saw the previous week because we're now figuring out better ways to make our services available to people. And that's why I'm so optimistic. That's why I'm so excited. This is the best time in healthcare because we've never been able to get better faster than we can now. And we've never had better tools to make these improvements.
So you're saying from what you're doing and what the potential is that technology is going to be a huge positive disruption in healthcare.
Matt,
Huge.
got to be done thoughtfully. Here we built the Hartford HealthCare Artificial Intelligence Institute. So we've got good governance, excellent oversight, good controls within the organization. But Robert, the answer is an emphatic yes. We've reduced our length of stay across Hartford HealthCare by a full day. we went years,
Wow.
decades trying to do that. And we built with MIT a new product called H2O that we applied that is now, it works in partnership with our daily rounding with our physicians and providers. It's amazing. I've seen things, Robert, like we used to have 3 people full-time working in emergency departments doing manual scheduling and updating shift to shift, the really extraordinarily difficult challenges of overseeing emergency departments. It now happens real time through automation with the push of a button in 3 seconds. And we've taken those people who are now back working at the bedside, doing teaching, coaching, mentoring, oversight, preceptorship. So endless opportunities. It's happening every day. And we're really at the beginning of the beginning.
Yeah. It makes sense because you sort of won what's called like the Stanley Cup of healthcare this year, right?
I'm so proud. I'm so proud of this. We have 45,000, the most amazing colleagues, the most amazing people, an extraordinary culture here. The American Hospital Association has a very rigorous, very disciplined process to provide the prize, the Quest for Quality prize, and they spent several days here with 5 or 6 reviewers doing an intensive process. We filled out a 100-page type, application, and we're very proud to be selected as the lead organization in our country for quality and safety. And it's the reflection of decades of work, tireless focus every day. And it's our purpose, right? Around quality, around safety, around fulfilling that promise to the 27,000 people we care for every day. So a point, Robert, of great validation for our people. And it allows us to even have more ambition and more inspiration to do more and to do better for our communities.
And when you talk about your culture, you have this saying that you've told me, which is being better at being better. Explain. I mean, it sounds very cool, but I want to hear. And we got 600,000 people listening in. They want to hear for their own companies, whatever industry they're in.
Yeah, we live by a focus in Hartford HealthCare about an ambition to be the best at getting better. And this is about our obsession with continuous improvement. And our ambition is to be better tomorrow than we are today, to be better, next year than we are this year. And it's not about being the best, right? It's not to what end and what purpose, right? That's a moment in time. It's
Mhm.
about recognizing the constant opportunity, that obsession for continuous improvement and getting better. So, I love our culture. I'm amazed and inspired by our people every day, and people who are challenging the status quo, trying to figure out ways to do things differently and better, willing to fail forward. But this understanding that we have a tremendous mandate in healthcare to get better. The issues around access must be addressed. The issues around affordability must be addressed. We have to drive the cost of healthcare down. We have to change the locations of where and how healthcare is provided. The issues around health equity, around people's zip codes can't define, right, their life expectancy, and it does across America and here too. And then the things we call never events, Robert, they still happen, right? They happen less than ever before, but they still happen. So the idea about being the best at getting better is about improving access, affordability, health equity, issues around excellence and quality. So I'm inspired by our people. We embrace the notion about being the best at getting better. And it's a rally cry within our organization, and it's a culture, and it's a philosophy, and it's deeply personal for us.
Anyone who wants to know more about Hartford Healthcare, what's the website they should go to?
HHChealth.org. So we would love for people to go learn more about Hartford Healthcare. We love partnering with health systems both across our region and across the country. We participate wherever and however we can on trying to make healthcare better across America. We partner closely with the Leapfrog organization. We partner closely with the American Hospital Association, the Connecticut Hospital Association, the Greater New York Hospital Association, all trying to contribute. And so we love being part of it. And I'm an advocate and a believer that these are breakthrough moments in healthcare in America. The challenges are significant, but we're seeing real positive impact. I mean, Robert, just on a daily basis, right? There's less people being harmed than ever before. Again, the things that we work to make never events happen less frequently than ever before. We're getting better, and yet the challenges to make healthcare better are enormous and must be addressed.
Okay. On that note, we're about to take a commercial break. When we come back, there's a whole concept that Jeff has led called healthcare is a team sport. You're going to find out about his leadership background and where that emerged from, what it might mean to you. Back in a few. Hi, this is Robert Reese back on the CEO Show, where we interview the CEOs who have reinvented the fabric of America. We're here today with Jeff Flaks, who is the president and CEO of Hartford HealthCare. And let's talk about your background, because you've been with Hartford, you've been at the helm, steward, for over 21 years, and you've been in healthcare for a long time, even though you look pretty good, I will say. You haven't aged in all the years I've interviewed you. But I want to hear about your journey and then lead into the concept of healthcare being a team sport and what that means.
Yeah, first of all, I had the privilege, I've been here 21 years at Hartford HealthCare, which is the blessing and a privilege of a lifetime. For the majority of my first 13 years, our CEO, Elliot Joseph, did an absolutely extraordinary job building Hartford HealthCare, brought a vision to create this health system, and I was able to serve as his chief operating officer for that time period. For the last 6+ years, being the CEO has been just an amazing opportunity because, Robert, I'm from Connecticut originally. My parents were public school teachers. My dad taught for 43 years in Connecticut. My mom taught for 35 years. My sister is a public school teacher in Connecticut. So I come from a family that cares deeply about public service, that cares deeply about community, and that has spent the greater aspects of our lives trying to help make Connecticut better, right, and change people's lives. So for me, I've had tremendous good fortune. I did my graduate work in Washington, D.C. at George Washington University, and GW changed my life. Had the opportunity to go work in Detroit at the Detroit Medical Center, where I met Elliot Joseph. In fact, we both worked there together. And I had tremendously important formative years working in Detroit, learning really at the seat of extraordinary leaders at the Detroit Medical Center, in one of the most progressive and pioneering healthcare markets in the country. And then I had the great privilege of working in Manhattan, in New York City, for 6+ years, having an opportunity to work amongst, the leading academic medical centers in the world, in really the world's capital. So in that time period, Robert, I had a very defining moment. I was on September 11th in 2001 at St. Vincent's as part of the leadership team, which was the responding hospital, and that has shaped my entire perspective on healthcare, on the importance of hospitals and health systems and the role they play in the community, around readiness, preparedness, and around service. So I've had great good fortune, and then almost immediately after becoming CEO of Hartford HealthCare, March of 2020 happened 6-7 months later, and we found ourselves in COVID. So really, in many ways, the defining kind of goalposts of my career was really serving as the primary responding institution to 9/11, and then more recently helping lead the efforts in the state of Connecticut to respond to COVID. So I've had great fortune to be able to be in the right place to contribute, to our communities in times of great need.
And explain the concept of it being the ultimate team sport. Why is healthcare the ultimate team sport? And if someone is listening in and they're not in healthcare, is there something they could learn from being a team sport?
Gosh, I'll tell you, it really is the ultimate team sport. First of all, talk about 9/11 for a moment. I mean, we never saw greater teamwork, greater selflessness, greater service than we did in those moments. And certainly during COVID, it was exactly the same thing, even for a more prolonged period of time. Every day, if you look in our operating rooms and you see some of the world's greatest surgeons and proceduralists, those people are supported by teams of circulators, nurses, physician assistants, advanced practitioners, anesthesiologists, CRNAs, central sterile supply, environmental services, biomedical engineers, facility engineers, schedulers, registration experts, people who work in billing, people who work, across the PACU and recovery areas. I mean, I could go on and on and on, Robert, about the hundreds of people who have to come together and work with tremendous precision and collaboration and coordination to make that one event, that singular procedure or surgery, a success and safe event. So healthcare is the ultimate team sport. It's people coming from all backgrounds, all types of training capabilities, all types of purposes to come to the purpose, right? Which is for caring for people, taking care of our community, being here, being ready, and ensuring we do it in the safest, highest quality way. So I value and respect teamwork above all else. And it really is the notion that each person's role is crucial and critical. Each person's contribution is immense to get the outcome and to get things like, you know, that recognition for our really national leading quality that we produce. It's because there's 45,000 people who come together to do that, and every person, no one more important than the other.
Final question. MSK, this was a special year for you. Explain exactly what happened and what that means to healthcare and anyone who needs that right now.
I'm so excited about this. You know, we launched with MSK. We have a wonderful relationship with Memorial Sloan Kettering. I mean, you know, they're the best in the world at what they do in so many ways. And they have a great vision under their CEO, Dr. Selwyn Vickers, to continue to expand and bring their world-class, you know, world-leading capabilities and programs and services, their research, their clinical trials to more, to make it more accessible, to make it more affordable, to make it more close to where people live and are. So for us to have the honor and the privilege of launching the MSK Care Partner program, to be the first care partner where we are working now together to achieve concordance, where MSK is overseeing our quality, our safety, and being able to demonstrate through analytics and data that getting healthcare in Connecticut in our centers has the MSK standard in place from a quality and safety standpoint, and to take the 900 plus clinical trials and the leading capabilities they have around research and around new drug development, and for us to be able to administer that local here so it's available to all, so everyone can get it regardless of ability to pay for it or travel for it. This is an amazing thing. It's going to make healthcare better across the country. It's going to make cancer care immensely better. We learn from each other. This is a deep partnership. It's very meaningful. It's extremely substantive. It's built on quality. It's built on constant analysis and reporting of data and patient outcomes. And it really is about outcomes. So we're making cancer care better in Connecticut as a result of this. And I'm comfortable over time, you'll see this expand around the country. But what an honor for us to be the innovator and to be on the, you know, the leading edge of creating this with our partners at Memorial Sloan Kettering. We're very proud to be doing it.
And congratulations on that, Jeff. You're really making a profound difference in healthcare. What a pleasure it is having you on the CEO show again.
Oh, thank you. My pleasure. Thank you, Robert. Thank you for everything you do. Grateful for your thought leadership.